The terms emotional abuse and psychological abuse are often used interchangeably in clinical literature, and, in many contexts, they effectively are. However, some authors propose a useful conceptual distinction, even though the boundaries remain blurred. Emotional abuse. This refers more specifically to behaviors that directly affect a person's affective sphere: devaluation, humiliation, constant criticism, emotional indifference, affective rejection, ridiculing of feelings, punitive silence. This is abuse that primarily operates on the level of feeling, undermining the victim's self-esteem and sense of personal worth through the emotional channel. Psychological abuse. This is a broader term which includes emotional abuse but also encompasses more structured cognitive strategies of control and manipulation: gaslighting, which is basically denying the other person's lived reality; progressive social isolation, manipulation through threats or guilt; control of information, and systematic distortion of the victim's perception of reality. Psychological abuse aims not only to affect emotions, but to destabilize the person's ability to trust their own judgment, memory, and perception. In summary, one could say that emotional abuse acts mainly on the heart, while psychological abuse acts on the mind, although in clinical practice the two almost always intertwine and rarely appear in pure form. The consequences of both forms of abuse, when prolonged over time, can be profound and lasting, and tend to manifest across multiple levels. On an emotional level, people who have experienced prolonged abuse often develop a marked impairment of self-esteem, chronic feelings of shame, unwarranted guilt, and difficulty recognizing and trusting their own emotions. Anhedonia, meaning a reduced capacity to feel pleasure, and persistent depressive states are not uncommon. On a cognitive level, especially in cases of psychological abuse involving gaslighting, there's often an observed impairment in the ability to make autonomous decisions, a constant doubt about one's own perception of reality, sometimes described by victims as always feeling confused, or no longer knowing what's true, and difficulties with concentration linked to a state of chronic hypervigilance. On a relational level, the consequences often include difficulty trusting others, dysfunctional relational patterns that repeat in subsequent relationships, hypervigilance toward signs of rejection or criticism, and in some cases an anxious or avoidant attachment style that becomes a stable relational pattern. On a physiological level, the literature on trauma and chronic stress documents significant correlations between prolonged exposure to psychological abuse and alterations in the hypothalamic pituitary adrenal axis, with consequences for sleep, immune function, and stress regulation. In diagnostic terms, when exposure has been prolonged, especially if it began during developmental years, the resulting picture can be consistent with complex post-traumatic stress disorder, CPTSD, which is characterized not only by classic PTSD symptoms, but also by persistent emotional dysregulation, stable alterations in self-image, and significant difficulties in interpersonal relationships. One last clinically relevant point: unlike physical abuse, emotional and psychological abuse are often harder to identify, both for the victim and for outside observers, precisely because they leave no visible marks. This can lead to minimization of the experience, both internally and externally, with a significant impact on the timing and manner in which the person eventually seeks help.